Hello, welcome to season 5 of the Baby Manual podcast. This season, I'm doing something a little different, and I'm speaking with pediatric subspecialists who are all experts in their field, so they can tell you about the sort of things that they see in the office and reasons that you might be referred to a subspecialist, and then some things that you can do at home while you're waiting for your specialist visit. Today, I have the pleasure of speaking with Dr. Victoria Martin, who's an MD and an MPH, and she's just amazing. She talks all about things like blood in the stool and milk protein allergies and other signs of food allergies in children. So I think you'll really enjoy it. Make sure you listen to the end. So welcome, Dr. Martin. Tell me a little bit about yourself and how you got into gastroenterology.
Thanks so much for having me. I'm really excited to be here. I trained in pediatrics, so like you, knew very early on I wanted to take care of kids and had a particular interest in babies. And then during my training, I became really interested in things that happen in babies' intestines, particularly very early on. I was interested in the microbiome, so all of the bacteria that populate our infant gut, starting out from what they get from breast milk, and then ultimately the things that may or may not lead to kids having food allergies or fussiness or reflux. And so I do a lot of research trying to understand more about that.
That's really cool. I've heard it explained that like the gut is sort of like a second brain for the body, that it really affects all kinds of things and it's not just about eating and pooping, right?
Totally. And we're learning so much more about, as we get older, the ways that our emotions and the way that we think actually translate into how our gut is feeling. And if you think about, there are lots of expressions we have in many languages about like trust your gut or listen to your gut.
Mm-hmm.
I think there's lots of ways in which we think those two things are really connected.
Yeah, even if you think of like butterflies in your stomach or things like
Totally.
that. Yeah,
Yeah.
that's cool.
Yeah.
So what are some of the things that you see early on in babies as a pediatric
Yeah.
gastroenterologist?
One of the most common things that I see are babies that are fussy, and particularly that are fussy and spitting up.
Mm-hmm.
And sometimes I see babies where there's a question of whether that may be caused by a certain food, either an ingredient in their formula or something that their mom is eating. And so I'd say in my practice, that's one of the things I see most commonly.
Yeah. And where would you sort of draw the line between, sort of a normal amount of fussiness and spittiness versus we need to really see somebody about this?
Yeah, it probably makes the most sense to separate them out. So a baby that's spitting up, so that's, some of their stomach contents from having, recently fed coming up, and either you can see it come up almost all the way, but then they swallow it back down, or actually come it all the way and then spit it out. We call that reflux, and that's normal in babies. They're not quite great at keeping everything in their stomach until they get a bit older, get a little stronger trunk, sit up more, things like that. And so if they're spitting up, but it's relatively small volumes and it's not shooting across the room and they're not very fussy, then we don't do anything about that. That's considered normal. We call that physiologic reflux. On the other hand, if they're really unhappy, really uncomfortable, and it seems to be getting in the way of things that are important, like sleeping and eating, then we start to think about gastroesophageal reflux disease, which means exactly that. It's something that's causing a problem. And that is when we start to think about doing more testing or intervening in some way.
Cool. Is there anything that parents should try in the meantime while they're trying to decide, like, is my baby spitting up too much or how can I help them spit up less? I know I have a couple episodes in the past about this with just sort of tricks like keeping them upright for 20 or 30 minutes after eating and things, but
Yeah,
extra
I think
ideas?
the first thing when you're worried about something is to pay a little more attention to it and to write down some details. You always get to that doctor's office and then they ask you questions about like, how many times did they poop yesterday? And you think like, gosh, I wish I was writing that down.
Yeah.
That doesn't mean we need to spend our whole lives writing everything our kids are doing down. In fact, it's probably much better if we're just present and enjoying them. But when there's something that we're worried about, it's helpful to keep track. Some parents have like an app on their phone, or some parents have a little notebook in their kitchen that is where they keep track of some symptoms. And what you could keep track of is how often this thing is happening. If you notice that it's a certain time of day, a certain time away from eating or drinking, and if it seems to be related to any particular foods that you, the mom, are eating if you're breastfeeding, or if the child's old enough to be eating other foods than certain foods that you're giving them. So data gathering, I would say, would be the first thing you can do before you get to that appointment. Um, and then, like you mentioned, holding kids upright for 20 minutes after feeds if you're worried about how much they're spitting up or maybe refluxing. Burping is an interesting thing. Some people feel like it helps a lot, and I think some babies really benefit from being burped. Other babies, it seems to make them less comfortable, or they don't like being interrupted. And so there's some old studies actually about like frequent burping also leading to more reflux. So I think that's one that just sort of depends on the baby, seeing what works for them, the timing of the burping, and how often you do it. And then there are some over-the-counter medicines that you've mentioned in your, I think it was in your tummy troubles episode, like simethicone, which is an over-the-counter medicine that parents can try. And those are sort of the primary things that you could try and see if it makes a difference.
Cool.
Before you talk to your doctor.
You had mentioned possibly foods that mom was eating if she's breastfeeding. How long would you say it takes foods to get into the breast milk after mom eats them? Because it's not immediate, I don't think.
I purposely left that out because I worry that moms and parents eliminate foods from the diet when they're feeling particularly desperate. And I think years ago, not that many years ago, we thought that that was pretty harmless, right? You take this thing out of someone's diet, mom's or the baby's, if the baby's eating solid foods yet, and they get better. So like, who cares, right? That's a great non-invasive intervention. The problem is that we've learned that having a really varied diet and particularly having early exposure to allergens, proteins that might be allergic someday, consistently in babies' diets is actually preventative against real life-threatening food allergies later. Mm-hmm. So we're really trying to move back away from eliminating lots of foods from people's diets without really having a methodical approach with a doctor helping you decide if that's the right thing to do. To answer your question, though, when you take an allergen out of a mother's diet who's breastfeeding, the data is really rangy. It can go anywhere from, being out of the breast milk in 24 hours to maybe taking 72 or longer. And then it takes time for the baby's system to get less inflamed or less allergic if that was causing a problem. So we usually tell folks if they eliminate a food, milk protein, cow's milk being the most common, that it really takes about 4 weeks to make a decision about whether you think it helped or not.
Yeah. And I know you have to be very strict about eliminating even traces of that from food for it to really be considered an elimination.
Yeah.
Right?
Yeah. And we do have some parents who feel like when they just reduce the amount that's helpful. And honestly, that might be less potentially harmful than total elimination from an allergy prevention perspective. So I think that's pretty harmless, but it's also really important that moms who are breastfeeding are getting a really healthy, robust diet and all the calories they need. And so I think it's super important that if that's something you're thinking about, that the mom or the lactating mother has the opportunity to see a nutritionist or talk to someone to make sure they're getting the nutrition that they need.
Yeah, that's great advice. I always tell parents, don't cut anything out of your diet when you're breastfeeding. You should and can eat everything. Yeah. And a big variety is always better because then babies are getting exposed to all those proteins of new foods. That's great.
I think for the vast majority of people, that's definitely true.
So for things like, there are some foods I feel like that can make reflux a little bit worse, or fussiness or gas, things like caffeine, garlic, I've heard, maybe some cruciferous vegetables. Is that something does that really happen? And when do you see the effect of that, I guess?
Yeah, as you know, things like this are really hard to study. And so these are the kinds of things that I talk about in a common sense way. If you notice when you're making that diary that every time you eat garlic, your baby seems uncomfortable, backing off the garlic might make sense. In large scale studies, any that have been done, I'm not aware of any that give really compelling scientific evidence that removal of some versus others make a big difference. But it's not harmful, like we said, to try and reduce or remove temporarily as long as we keep our diet pretty varied otherwise, and that we don't continue it if it didn't make a big difference, if it didn't make a big positive change. One of the things that parents ask me a lot about is what the infant stool looks like. And sometimes they're really worried about thinking that there might be mucus in there or blood in there. And sometimes that can be a sign of allergic inflammation in the GI tract or this milk protein allergy or intolerance. But also some amount of mucus is normal because bacteria make that in your baby's intestine, and it's normal to have some amount of mucus. So we talk about, again, this is where the innovation of phones and cameras that are easily accessible has changed a lot. My patients all come with an album full of pictures to show me. And we laugh about it, but it's actually really helpful. A picture is worth 1,000 words. And sometimes parents who are really worried can be really relieved just to have sent a picture. Some of them have a patient portal they can upload to, or a way that they can bring it to their doctor visit. And that can be really helpful for us to take a look and see if anything is concerning to us. Blood in the stool is almost always not normal. And so if you see that, that's definitely something to call your doctor about and talk through, with the exception of a newborn baby girl in the first few days of life. Other than that, that's not normal and something to talk about.
Right. And I also will sometimes suggest to parents to bring in diapers
Mm-hmm.
just in case they don't poop while they're in the office. If you have
Yeah.
one at home that you think has blood in it, there's a lot of things that look like blood too once they start doing solids, especially watermelon, I feel like is a big one because it
Yeah.
just like compresses down to these little red strings and really looks like blood. So yeah, if you bring in
Yeah.
the diaper, the doctor can always test it for blood.
Yeah. The common test that we use in the office is called a guaiac test. It's not perfect and it has a lot of limitations. Both it can be fooled by certain foods, like you mentioned. But we also, in our research study, have noticed that even totally healthy babies with no symptoms, about 10% of them, if you test their stool, will be positive for a little bit of blood at that age, at that like 1 to 2 month age. And so it may be that some amount of that is actually normal, and that's something we don't totally understand really well yet. But it is a test that some doctors will use to kind of, it's really helpful if it's negative, I think, because then you know it's not blood. I think if it's positive, it sometimes gives us a little bit more thinking to do.
Yeah, that's cool. Tell me more about cow's milk protein allergy and how that actually is diagnosed now.
Yeah. So typically, babies with cow's milk protein allergy or intolerance, and I should say, we need a new term for it because technically it's not an allergy the way that like a peanut allergy would be that you need an EpiPen for that's life-threatening. This is an entity that happens in little babies. It usually starts around 1 to 2 months of age. And those babies present pretty fussy, sometimes very refluxy, so spitting up a lot, and often with blood and or mucus in the stool. And so it's sort of a clinical diagnosis. That means that your doctor can make the diagnosis just by listening to you and your story and looking at your baby, looking at pictures of stool if you have them, testing the stool for blood maybe if they think that that's helpful to confirm. And then taking milk out of their diet, cow's milk, either changing their formula if they're on a cow's milk based formula, or taking milk out of the mom's diet if she's breastfeeding, and seeing if the symptoms go away as part of the diagnosis. But actually, internationally now, there are guidelines that if that works, if you think that works, you have to put the milk protein back in the diet and prove that all the symptoms come back. That's called an in-home challenge before you can technically make that diagnosis. And to be honest, most people have been skipping that for a long time. And now that we know what we talked about a little earlier about how important it is to probably keep these things in babies' diets, we're getting better at doing that challenge. And what's so interesting is that there are so many babies that when you were sure they got better when you took it out, a month later when you give it back, they don't have those symptoms anymore. And so we don't know if that's because we were wrong the first time, or if it's just very transient, meaning something that their little GI tract figures out in just that month break, and then they can tolerate the food again.
That's really cool. What I remember is that things like milk, soy, and eggs are allergies that kids tend to outgrow as they get older, but things like nut and fish allergies don't really go away as they get
Yeah,
older.
some
So,
nut allergies kids outgrow, and we're learning a lot more about how we can speed that along. So there are both some newer medicines on the market that might help kids outgrow their food allergies, and there are also tests we can do, and then ways that we can do desensitization, meaning giving tiny little bits of the food that they're allergic to try to help them outgrow it when they're at a safe level of allergy. But yeah, milk is often an allergy that's outgrown, and egg as well. And so that's part of why we want to make sure that once, even if we make a diagnosis of cow's milk allergy early in life, that we're constantly questioning whether kids are still allergic. And that's when you would need an allergist or a gastroenterologist or your pediatrician to guide you.
that's cool. And if they are on a milk-based formula, do we still change them to a hydrolyzed formula?
Yeah. So this cow's milk protein allergy or intolerance that I'm talking about is a non-IgE mediated food allergy. And so that means that it's not the kind of life-threatening allergy that we normally think of, kids that have to go to an emergency room or have an EpiPen. There are kids that have that to milk, but it's much rarer in infancy. And so for that entity, we often change formula if the baby's formula fed, and we change from a standard cow's milk based formula to usually an extensively hydrolyzed formula. So that means that they take that milk protein and they put it in a processor that chews up all those proteins into tinier chunks called peptides that the immune system, we think, doesn't react to in the same way, or maybe the gut microbes don't react to in the same way. We don't actually know how this mechanism works. And most babies will get better on that formula. Some babies need a fully hypoallergenic formula. And that's when they just, instead of having that protein in at all, instead they put in each individual amino acid. So those tiny building blocks that make up a protein. And kids often will get better on those formulas. The same principle applies, that concept of a challenge. Even if they get much better on the new formula, it's recommended by all the international guidelines now that you actually switch back a month later to make sure that the symptoms really come back and you're really doing the right thing, or that it's something that they still need before committing them to 6 or 9 months of that formula before they turn 1.
Wow. And that's just a month after
The
starting
symptoms
that
get
change.
better. Yes, you start the change, the symptoms get better.
Okay,
and then
that
2
can
to
take a
4
few
weeks. Yeah. And then 2 to 4 weeks after that, we feel like the symptoms are really convincingly better. Then that's when both the DRACMA guidelines and the SPGAN guidelines and the IMAP guidelines, these are all acronyms for big societies that got together and wrote these ideas down, recommend.
That's really cool.
Yeah.
Awesome. What other sort of things seem to come up in gastroenterology?
Yeah. So speaking of parents who love showing me pictures of diapers, constipation is another thing that parents often ask about. And many people don't realize that it can be totally normal for babies, particularly new babies, to poop 7 to even 10 times a day at those first few weeks at home. But it's also just as normal for them to go 7 or sometimes even 10 days without pooping. And so that can be distressing to parents, and it can also look distressing on the baby. There's this thing called infant dyschezia, which is the medical term for babies looking really uncomfortable when they're pooping, squirming, scrunching, face turning all red. And it's actually just how they poop. I tell parents sometimes to think about how hard it would be to poop if you were laying down, which is what babies are most often doing. You can't quite get into the right position, right? And so that's why they're so squirmy and turn red. And so all of those things can be normal. We really define constipation by what the poop looks like. And so if babies are really constipated, the poop will come out very hard. And that can either be like little pellets, like almost like little rabbit pellets, or if you've seen other animals that have those hard, dried out little pellet stools. Ones that if you tried to squish in the diaper would be sort of hard to squish, that hard. Or sometimes babies can hold on to a lot of stool and then have a big, big stool that's like a ball that's hard as a rock. And that also can be a cause of blood in the stool, because if it's so big when it comes out, it can be painful and cause what we call a little fissure, like a little cut there. And so both of those would be reasons to talk to your pediatrician. In young infants, the first thing we often try is prune juice, not to drink like out of a bottle, but as a medicine in small amounts. Yeah, exactly. And
like half an ounce to an ounce of straight prune juice per day, right?
Exactly. Yeah. And then as kids get older, if they're eating solid foods, then we can preferentially offer things that start with P conveniently. So prunes and pears can help a lot. Some families feel like mango helps a lot. And so focusing on some of those foods and a little less on things like banana and dairy products that can be most constipating is really helpful. And this often comes up when kids are starting solid food introduction, because their gut is getting exposed to all these different foods that are a little harder to digest. And so parents often say they went from pooping a few times a day and then they skipped 3 days and they're panicked because that seems like a different pattern. But that's really common as we're trying to introduce new foods.
Yeah. I also feel like around a month of age, when they go through that phase of discoordinate stooling, which is the same as sort of the dyschezia, they're learning how to poop, and then they hold it for a really long time. And then when they finally do poop, it's like a huge explosion out the diaper, out the back, all that.
Yeah, and usually when you have them in a nice white outfit and you're like in the
Always.
middle of a event or something is when they do that, right?
Exactly. Or in their car seat.
Yeah, right.
So
Always in the car seat. Always in the car seat.
But yeah, it comes out soft, so it's not actually constipation at that age. But it can be really alarming for your baby to go for several days without pooping. And
Totally.
yeah.
Totally.
I feel like everyone should have a Bristol stool chart in their
Mhm.
house.
Yes.
Those are the
Yes.
consistency of the poop, and just know that, like, yeah, in the middle is normal, and then the two extremes is
Yes.
not.
Exactly. And infant stools can be a lot more liquidy than even a 5 or a 6 on that Bristol stool chart can be normal in infancy. And then as they get older and eat more solid foods, it tends to firm up a bit, which makes sense based on what they're eating, right? One of the other things that families ask me a lot is what I think about the introduction of allergenic foods and like what foods I recommend introducing early when babies are ready and when to start introducing complementary foods. And the American Academy of Pediatrics recommends introducing solid foods between 4 and 6 months, and the WHO at 6 months. And some of this is a little complicated by the fact that we know that the earlier you introduce those allergens, at least peanut, the more likely you are to be able to prevent peanut allergy in kids who are at risk. So like kids with eczema or other atopic disorders or allergic diseases. You should talk to your pediatrician about whether they think that your baby's ready. And some signs of that readiness are that they're watching you and seeming really interested when you're eating salad. So all of a sudden their like head turns right as you're like trying to take a bite when they're sitting on your lap, or they're trying to grab for your spoon or your food. That's one signal. Another is that they're pretty sturdy in a high chair. They don't have to be like totally perfect, but they shouldn't like totally slump over to one side when they're sitting in their high chair. We call that good truncal control and head and neck control. And when all those are met, then often it's time to start introducing solid foods. And most people start with something really smooth and soft, like a puree. Once a baby is able to take a few spoonfuls of that reliably, then that's a good time to start introducing allergens and asking your pediatrician. Most of the time we recommend starting with peanut, which you can get in like a powder that can sprinkle onto foods. Or there are, once they're ready to start to chew and swallow a little bit, there are puffs that have peanut protein on them that can help prevent peanut allergy. Those are called Bamba. My kids loved those. Yeah. They're not the healthiest otherwise, but they're good for this purpose. And, I think particularly if you're introducing really early, those smooth foods are going to go over better. As kids are a little bit older, they can tolerate more sort of fork mashed table foods once they start to really learn to chew and move things around in their mouth.
Yeah, or even just like a dot of peanut butter on your finger.
Yeah.
And try in their mouth.
Yeah.
No, they're also getting some of that with breastfeeding, right? So I feel like breastfeeding babies get introduction from birth to all these proteins.
It's tricky. For peanut, that wasn't enough to be preventative. So in the big study called the LEAP study that they did in Europe, what really made a difference was giving that protein straight to the baby starting at 4 months. And the reason that study happened is because they noticed that kids of very similar genetic backgrounds that were living in Europe compared to those living in Israel had very different rates of peanut allergy. And they figured out it was because these Bamba were given so commonly as a first food in one country. And so they were sort of like we talked about before, like desensitizing to peanut early on. And so that's how we learned about that. And that was regardless of whether their mom was also breastfeeding and eating peanuts. So breastfeeding is definitely super important, but it doesn't quite have the preventative effect that we'd like to have, which is why this introduction recommendation came along.
That's really cool.
Yeah.
And then some of the other, because I know, or last I knew, the only real big study was on peanuts in the early introduction.
Yes.
But do we just assume the sort of top 8 allergens we want to introduce early, like milk, soy, wheat, eggs?
Yeah, the data is a little bit more conflicted for other foods. And that means that depending on the way it's studied, scientists have found some positive effects and some no harmful effects, but not good effects. And I think that has to do with a lot of things, but like which kids it was introduced to and how it was introduced. So for my own kids, I definitely, as they were ready developmentally, made sure that they got exposed to a wide range of foods and particularly allergens. The key, particularly with peanut, which is the one we know the most about, is that once you do it, you want to keep doing it. So it's not like you give them peanut once at 4 months and pat yourself on the back that they didn't have an allergy, because in fact, it can take a couple exposures for that allergy to come along. And so once you're doing it, you want to do it at least a couple of times a week and kind of keep it in the rotation.
Mm-hmm.
Yeah.
And then also keep an eye out for food allergies, like you said, where,
Yeah.
when they're very young, it's the blood in the stool. But then once they start eating solids, it's more vomiting, rash, that kind of thing.
Yeah. I'd say that when I think about a true allergy or an IgE mediated allergy, the symptoms of those would be hives. So that's that rash with like those big welts all over the body and is usually very itchy. Vomiting can be a sign, and certainly trouble breathing, wheezing, or drooling. Those would all be reasons. I wouldn't even call your doctor. I would call your emergency services number 911 here in the US if you saw things like that. But the blood or mucus in the stool isn't necessarily a sign that your kid would have an allergy like that. And in fact, those kids may be the kids that are even more important to do some of this early introduction to other allergens like peanut and egg.
Yeah. And then if they do have that allergic reaction, I always say wait until they're at least a year old and you've talked to your doctor before reintroducing that food.
Yeah, and usually they'll do some blood and skin testing, and that helps prognosticate. That helps us figure out who is safe or ready to think about reintroduction and under what circumstances. Is that someone who could introduce it at home or should be in a hospital or in a clinic office? There are many offices in the US that are trying to get kids in, and many other countries around the world trying to get kids in early to do some of those challenges early on, again, to try to get this ball rolling sooner, so to speak.
Yeah. I feel like the two biggest times I saw constipation when I was working outpatient was when they first started solid foods, because parents weren't necessarily giving water with it and kids were getting a little dehydrated because they're just eating all this extra food but not drinking enough. And then around a year of age when they started giving them straight cow's milk when, yeah.
Often in like larger volumes than maybe they should have. Yeah, totally. And then the third time that's the most common after that is potty training. And that has to do a lot with how kids are feeling in their own body and trying to hold on to the stool and maybe being a little afraid of the toilet. And so, yeah, those are definitely the three most common times that we see parents worried or thinking that there might be constipation.
Yeah.
Yeah.
And when it comes up around potty training, I think that's often the hardest one to treat too, right? Because they get into that cycle of like, it hurts to poop because their poop was hard. And so then they withhold more and then it's even bigger and more painful the next time.
Yeah. And so when that happens, we think about a couple of things. We think about backing off on any amount of pressure that we're applying to do this thing right now that is going to poop in the potty. Thinking about ways to make it fun and positive. And so sometimes like a basket of fun activities that they're only allowed to do when they're sitting on the potty. Rewarding just for sitting. So encouraging just for sitting there, not necessarily producing anything. But then also with the help of your doctor, it's our job as the medical team and the parents to make sure that poop never is hard again, so that we don't reinforce that idea that it's hard and might be painful. And so we can do that with those pee foods that we talked about. And sometimes kids need medicine for that period of time also to help make sure that there's plenty of water in the stool and it's nice and soft. Yeah. And tackling that early, like right when it shows up, is really important because it's much easier to treat then than it is when they're 5 or 6 or 7 and still having trouble with constipation or withholding.
Yeah, definitely.
Yeah.
And also the medicines that we do use for children are safe in children, right? We usually use Miralax, which isn't habit forming like the other, like adult laxatives are different.
Right. Miralax, which is also for adults, it's the same bottle, but it's a powder that is an osmotic agent, meaning that it just helps bring more water into the lumen, into where the stool is formed. And it actually, the medicine and the poop all come out together, so it doesn't get systemically absorbed. And there have been big studies now to show that it's safe for use in kids. And it's my favorite medicine when I have to turn to a medicine to use.
Yeah. Mine too. I tell parents it's kind of like those Orbeez gel beads, that you put them in water and they puff up. It's like that on like a microscopic level. It's just like powdered of that. And so it just pulls water in and poofs up a bit. And they do have to drink lots of water to keep everything moving and to get it to work.
Yeah. One of the most common things that parents ask me is, how can I help improve my child's diet? And particularly in those toddler years when kids are starting to exert their opinion about all sorts of things. And so I think the most important advice I give people is to include your kids as early as you can in food and meal preparation in whatever way that works for your family. And I always think it's so interesting culturally. Some places we naturally include kids in food prep when it's like cookies. And
Yes.
I always laugh about that because like they're going to like the cookies either way. You don't need to include them in that.
Right.
And so like my kids have been involved in making the salad every night since they were 18 months. They could, stand safely next to the counter and they have their own little food cookie cutters and they cut out fun shapes of the vegetables and those all go into the salad. And it's remarkable how interested they are in the salad when they made it compared to when I made it. And particularly if they're involved when they're most hungry. So that time like post school or daycare when, you're trying to get dinner ready and it feels a little crazy. It's when kids are most likely to steal a bite of that bell pepper and try it for the first time and maybe realize that they like it. So that's one of the first things I talk to people about is engaging your kids very early in the foods that you like as a family. And as much as that can be fresh fruits and vegetables, that can help head off that constipation from coming later and help keep their gut really healthy.
Wow. Thank you, Dr. Martin. This has been fascinating talking to you. I love hearing about all the different stuff that you can help with in pediatric gastroenterology. And it really feels empowering for the parents listening too, that there's so much that they can do at home before having to go to the doctor. So thank you so much for being here.
Of
Any
course.
other closing words?
I don't think so. Thanks so much for having me. And, being a parent is really hard. And I think I thought I understood that when I was a pediatrician before I was a mom. And then now that I'm a mom of two little ones, it hits a little different, right? And so I think listening to your gut is the right thing always. And when you're worried about something, we gave you some tools here today to process that, but also it's never wrong to talk to your pediatrician and tell them what you're thinking about. And that's what we're here for. That's our job to help you decide when to be worried or not. Thanks for having me.
Yeah, thank you. Thank you for tuning in. Make sure that you like and subscribe so that you can be the first to know when new episodes come out. Also, you can check out the first 4 seasons of the Baby Manual podcast on your favorite podcasting platform, or check out my YouTube channel for lots of videos and shorts that will help you feel empowered as a new parent as I answer all of the common questions that tend to come up in the first couple of years of life. Have a wonderful day.